Florence Nightingale was a very high-profile figure after she returned from the Crimean War. This meant that she became very influential in medical training, particularly nursing and also in the design and running of hospitals. Upon her return from the Crimean War, Nightingale's high-profile status allowed her to become exceptionally influential in medical training, particularly in nursing and hospital design and operation. In 1859, Nightingale published a book that would become a bestseller and get translated into 11 languages. It was called Notes on Nursing. With the money she'd been donated, Nightingale established the Nightingale School for Nurses at St. Thomas Hospital in London in 1860. This was Britain's first professional training school for nurses. The graduates of this school, known as Nightingale nurses, went on to establish training schools for nurses worldwide. These schools taught not only practical skills in treatments and patient care, but also Nightingale's firm beliefs in high cleanliness standards for patients, hospitals, and nurses to prevent the spread of infection and disease. By 1875, thanks to Nightingale's efforts, nurses' training had greatly improved. Nursing had begun to be recognized as a serious profession, a vital part of medical treatment. It transformed into a respectable job for women, attracting more, specifically middle-class women, to the profession. In this way, Nightingale significantly influenced the role of women in medicine, particularly in nursing. But Nightingale's impact didn't stop at nursing. She authored over 200 books, including Notes on Hospitals in 1863, which focused on hospital design and organization. Her work greatly influenced hospital operations and the construction of new hospitals. New hospitals were now built in the pavilion style with separate wards for different ailments and diseases, which helped contain infectious diseases and allowed doctors and nurses to specialize in certain conditions. Wards became more spacious, with individual beds and plenty of room for each patient. Large windows ensured ample light and ventilation. The building materials used were easily cleaned, and the role of nurses became more significant, leading to the employment of more nurses. Sanitation saw major improvements with the construction and maintenance of good drains and sewers. Clean water and fresh food became more readily available to patients, and proper toilets and washing facilities were provided for medical staff and patients. Laundry facilities were also provided for regular washing of bedding and clothes. Further improvements to hospitals included the introduction of antiseptics thanks to the work of Lister, which improved hospital care and surgery. As more people accepted Pasteur's germ theory, cleanliness became a universal standard, not just a principle upheld by Nightingale. More specialist hospitals, such as those for infectious diseases, started to appear, improving access to specialized treatment. So it's clear that Florence Nightingale's contributions to nursing and hospitals have been monumental. Her influence on nursing education, hospital design, and sanitation practices have shaped modern healthcare as we know it. Her legacy continues to inspire and guide us in our pursuit of excellence in healthcare.